So we just talked about your oral hygiene instruction, and now this is something I was going to see if you're interested in. It's called an Aristin, and it's just like a little antibiotic that we can put down into those deeper pockets that we talked about you having. So you have some 5 and 6 millimeter pockets, and that's just, basically a place where the bacteria can hide out.
Okay.
Yeah, so it's hard
so it gets stuck in there?
Yes, it's hard for floss to get down there. It's hard for the toothbrush. It's just hard to clean it out because it's so deep. Okay. And then if that bacteria stays in there, like, we talked about, it can cause bone loss and can lead to all sorts of stuff. So we wanted to really try to take action now and arrest it from progressing any further.
Okay.
So what it is it's just this little syringe, and it has the medicine in it. And you just insert it into the base of the pocket. It kind of looks like a needle, but it's not a needle.
Oh, thank God.
Yeah, it is not a needle. So you just insert it into there, and then I will insert the medicine. And it is an antibiotic, so there's, obviously are some side effects that you could have. Some GI upsets are sometimes common, but I will give you a list of all of that at the end. And then that will do a really good job of kind of killing the bacteria. And then along with the scaling and root planing that we do, where it's just kind of a deeper cleaning, just to really get all of that bacteria out of there.
So we can't just use this? It just won't do its thing?
No.
Okay.
Yeah. Just because, the medicine, it can only get so much if there's some bacteria that's been left on there and it's hardened or calcified into that, the tartar or the calculus, we like to call it. We have to physically remove that.
Okay.
Yes. Okay. Sorry, your question, it just threw me off.
That's
I'm having a Monday, I guess, or it's a Tuesday.
See, exactly.
Yeah. Okay. So there are a few things after I place it. For like home care and stuff. So we don't want you to touch the sites that I place it in. So if I place it over here, I don't want you to touch it. If you brush your teeth, you can brush all the way up until that tooth and then skip it. Okay? If you feel like you have to just brush it a little bit, just super, super lightly, gently brush the tooth surface, but we just don't want you irritating the gums because that's where that medicine is. It kind of sounds backwards, but we just don't want we don't want the medicine going anywhere because it's going to stay localized to that spot where you put it. Yeah. We don't want you eating hard candy, crunchy or sticky foods or gum, anything like that. And then another thing is don't floss. So just
there's that problem there.
I know, just that area. Still floss the rest of your mouth, but anywhere that we place the Aristin, we don't want you flossing for 10 days. Just to leave it alone, let it do its thing. And I also noticed on your notes that you have started smoking a little bit, and we really want you to stay away from smoking after we do this procedure because it can increase the risk of periodontal disease and just tooth decay, tooth loss, and maybe this might be a good start to quitting the smoking if that's something that you're interested in.
Yeah, I would be open to that.
Yeah. Okay. Well, I think that's it.
Awesome. Well,
do you have any questions?
No.
Okay.
Okay.
Thanks.